Hey, this is Max from UNFTR for the MeidasTouch Network, and it seems that the Trump administration has punted, for the time being at least, on the much-anticipated Trump-supported GOP healthcare plan. So we have so much to get into, but apparently the upshot here is that you can't design a comprehensive healthcare plan for 350 million people on the back of a napkin. So Trump's only opinion on the matter seems to be that he wants Americans to be in control of spending their money instead of the health insurance companies in control of spending the money. So he's tasked the GOP with the plan to give Americans money so that they can spend it on the health insurance companies. And if that makes sense to you, then hopefully there are some plans still available so that you can avail yourselves of them and check yourself into a facility, because it makes no sense. So today, we're going to run through the GOP options that they're reportedly weighing, the challenges moving forward for millions of Americans, and the bigger picture that Democrats are going to have to grapple with when this all comes crashing down. And we're also going to start with a clip from Scott Bessant to introduce the topic today because, well, he's my fave. So let's go.
Interest rates are down, and now we are starting to see the affordability. The prices get better. We had a very big October for home sales. Energy prices, gasoline is down. We saw, we believe healthcare is going to come down. We will see an announcement this coming week on that. And so across the board, prices are starting to come down. We're having Thanksgiving week. This will be the lowest cost for a Thanksgiving dinner in 4 years. Turkey prices are down 16%.
Honestly, I don't even know why I do this anymore. I mean, if the world's worst hedge fund manager, remember Scott Bessant lost 90% of the value in his hedge fund, while the S&P gained 167% over the same time period, so Trump put him in charge of all of our money? Well, if Scott Bessant thinks that you're a crybaby for complaining about gas prices and grocery prices, then maybe you're the problem. And better yet, they have a healthcare plan coming, so it's going to be much cheaper and awesome, so stop your whining. And he's right on all of it. Except that inflation is still above 3% and grocery prices are 25% higher than they were last year, and gas prices are literally unmoved. Oh, and they were going to release their plan, but then they decided not to. So as I mentioned on my weekly roundup on UNFTR this week, remember kids, when Scott looks like he's about to cry, and he has a lot of trouble using his words, it means he's lying. But there's so much more to this part of the story than Scott Bessant having a difficult relationship with the truth. The Trump administration was prepared to release its comprehensive healthcare plan as early as this week, just in time for Thanksgiving, as millions of Americans are nervously heading into the holidays with more debt, less money, and many facing a financial cliff with the health insurance enrollment window set to close on December 15. Now, you've probably heard that premiums across the board on the ACA exchanges are set to increase on average 26% next year. That is a staggering number on its own. But this situation is far more nuanced and even more dire than this increase. There are 24.3 million people enrolled in the ACA marketplace. 9 out of 10 of them have plans that are subsidized by the government, subsidies that will expire at the end of December. So we're looking at a double whammy. Insurance companies jacking up the premiums by 26%, and the subsidies that help people afford those premiums are disappearing entirely. So let me give you the real numbers here, and I do want to direct you to an exceptional piece by a guy named Steven Semler that breaks all of this down in forensic detail. Seriously, subscribe to his Substack. I'm going to leave it in the notes because this is the kind of reporting that we desperately need. So according to Semler's analysis, the federal government spent more than $124 billion supporting the entire marketplace in 2024. The enhanced subsidies alone cost about $35 billion annually, although that estimate was made before insurers announced their 26% premium hike. So it's probably going to get even bigger. So even with massive federal subsidies, marketplace coverage still costs consumers around $500 a month, $6,000 a year. That's for one of the cheaper individual plans. Forget about the family plans. So per enrollee, marketplace coverage is way more expensive than Medicaid. Now, there are 27 million uninsured Americans right now, and 2/3 of them say that their lack of coverage is because of the high costs. So when these subsidies expire and the premiums spike, We're talking about millions of people who simply won't be able to afford coverage. Now, the CBO estimates that 2 million more people will be uninsured next year. But that might be conservative given everything we know about the cost increases. So there's that. Now, here's where it gets really dark. And this is what Semler and others have demonstrated that most people aren't talking about. The crisis is a little more complicated than just subsidies on the exchange. See, under the Biden administration, we saw a historic flight from Medicaid coverage. From April 2023 to September 2024, 26 million people lost Medicaid coverage. Now, many states were purging rolls because private insurance options through the public exchanges provided comparable coverage, but only because of the enhanced subsidies. So this is how the shell game worked. During COVID, Congress required states to maintain Medicaid enrollment in exchanges in return for increased federal funding. So this continuous coverage provision kept people insured during a public health crisis. So Medicaid enrollment grew from 72 million in March of 2020 to 95 million 3 years later. And by March of 2023, more than 1 in 4 Americans were covered by Medicaid, including half of all children. But then Biden's budget for 2023 delinked Medicaid continuous coverage from the public health emergency and set April 1st, 2023 as the start date for allowing states to resume disenrollments. He signed the law in at the end of 22, and all but 1 Democrat voted for it. And here's the thing. 2/3 of those 26 million people that were kicked off Medicaid were disenrolled for procedural or administrative reasons, meaning they lost coverage because of red tape or the state dropped them in error, not because they were actually ineligible. So Texas, for example, disenrolled 500,000 people in a single month because, Texas. Florida kicked off more than 400,000 in the first 3 months. So the Biden administration created a special enrollment period for people who were losing Medicaid to sign up for marketplace coverage, which was scheduled to begin the day before Medicaid unwinding started. They literally engineered the whole transition. So by June of 2024, at least 3.5 million predominantly lower income people who were kicked off Medicaid had enrolled in the marketplace. This is the heart of the crisis that people aren't talking about. This move under Biden was a shift away from Medicaid in order to encourage sign up on the exchanges. But it's basically just moving one pocket to the other because people still needed subsidies to afford the rising costs. It was a Band-Aid that was always going to bleed out, especially if Republicans controlled Congress. And so here we are. So quickly, before we move on, I think it's important for us to remember here that the ACA was a Republican plan. It was literally created and adopted first by Republicans as a way to prevent immigrants and the poorest among us from accessing emergency room care as primary care. That's right, it was originally written by the Heritage Foundation and first adopted by Governor Mitt Romney in Massachusetts. And the big theory behind the plan was that an individual mandate would encourage mass adoption and therefore relieve the burden on hospitals to give away care that it ultimately wouldn't recoup. And it always was a giveaway to the insurance companies. That's why big insurance was so supportive of the ACA from the start. It was a windfall for them. Millions of new customers required by law to buy their product. It was amazing for them. So now fast forward to the Obama years when this very same Heritage Foundation plan was passed, and suddenly it became the third rail for the GOP because it was perceived as a generational win for the Democrats, more specifically for a black Democrat named Obama. And that's why they named it after him and then vilified it for years to come. So Republicans spent all their political capital from that day forward undermining the plan that they ostensibly created without having anything to offer in its place. The whole repeal part of repeal and replace was always more important to them than actually helping Americans get health care. They never had a replacement plan, and guess what? They still don't. So here we are, right? Trump was unable to dismantle the ACA in his first term, but then Biden built on this with this push to shift people away from Medicaid to the ACA exchanges, which left the whole thing vulnerable because now that Trump's back in office with the whole of Congress behind him, he's able to take the whole thing down. So that was the backdrop to the recent government shutdown. Democrats said they were not going to back off a spending bill until it reinstated the Obamacare subsidies, and this launched a whole thing, right? Schumer made this the line in the sand. This was the whole campaign. We shut the government down for 43 days, and then they caved. But they did say that they secured a promise of a future vote sometime in December to contemplate maybe restoring some sort of subsidy without saying what it was. A promise with the same party that has tried every single year, year after year since the ACA was passed to dismantle the ACA. So let me be clear about what this means. If the subsidies expire, which they will at the end of December, without congressional action, the premiums are expected to more than double for millions of Americans. And many of these people have marketplace coverage in the first place only because they were kicked off Medicaid by legislation passed under a Democrat. So they were promised affordable coverage and were funneled from one system to another, and now Democrats have effectively abandoned them. We have to be intellectually honest about this if we're to tackle what comes next and put a united front forward. And all of this comes at a critical juncture. Americans at the bottom of the K-shaped economy are sliding further down the economic ladder into genuine economic precarity. Bankruptcies and foreclosures are up dramatically year over year. Wage gains have stagnated. Mass layoffs are projected in the coming months due to waning consumer confidence and demand, persistently high inflation, and fears around AI job losses. And grocery prices, Scott, are still high. So are gas prices, Scott. Despite what you say and despite what the administration says about economic indicators, working people are feeling the squeeze every single day. Now add in healthcare costs that are about to explode for millions of people. Medical debt already drives roughly 1 million bankruptcies annually in this country, and we're about to see that number spike. All right, so what's the proposed solution on the table? Well, we were supposed to find out this week, but the announcement never came. Now, CNN and others report that Trump wants to send money directly to Americans, right? Something like a widespread health savings account that people could spend on care. And on its face, it sounds populist, sounds market-based, right? Power to the people, as he wrote in all caps on Truth Social. But the thing is, if we think about this for just 2 seconds, what would this cover? Would it cover prescriptions, surgery, diagnoses, routine visits, emergencies? Nobody knows because they haven't worked out the details of how this would actually function on planet Earth. So according to CNN's reporting, the framework under discussion would temporarily extend ACA subsidies in some form while incorporating guardrails like new income limits and requirements that all enrollees pay at least some premium. They're also discussing letting certain enrollees redirect federal aid into health savings accounts. But here's the fundamental problem. This is all incredibly complicated by design. It's also incredibly expensive to administer, and it creates even more confusion. The whole idea of insurance is to widen the risk pool. So if you give people money and ask them to ration it out for care, then you're relying on the marketplace to determine how much each individual care costs. And what happens in an unregulated market? Prices get driven higher. Providers and drug companies will lift prices as much as they can, and we're right back to where we started. This is fire to frying pan and back to the fire again. But here's the calls coming from inside the House problem that progressives are going to have to contend with. Apparently, the conservative wing of the Democratic Party, which is led by the Josh Gottheimer and Tom Suozzi problem solvers caucus that creates more problems than it solves, floated ideas that might be catching hold. Their proposal is to extend the subsidies for a couple of years to kick the can down the road and then implement means testing for who gets them going forward. But this approach ignores the cost driver aspect of healthcare entirely, and it moves the party further away from where it needs to be heading to get momentum and mojo back on the left. So these guys are Republicans in sheep clothing. Do not listen to the Problem Solvers Caucus. They are bought and paid for by the same interests that profit from our broken healthcare system, and they're going to use this crisis to push the party toward more market-based solutions that will only make things worse and more expensive. There is only one solution to all of this, and that is Medicare for all. Hard stop. End of discussion. Medicare for all has to be the tentpole idea of the Democratic Party. There is no other plan that checks as many boxes for the American people. Now, as it is, Medicare is the most popular government program according to literally every survey. It has the most efficient overhead model, so the administrative overhead for Medicare is around 3%, compared to 13% for private insurance. And that's not my number, that's the actual data. In other words, Medicare, the public government-run insurance program, is 5 times more efficient than the private market. The exact opposite of what we've been told our entire lives. With a risk pool this large, there's only one administrator that can provide the economies of scale and the efficiencies necessary. And if there's one compromise to be made, it's this. Start killing the private insurance markets by reducing the age of Medicare admission every single year until we have full coverage for all Americans. Phase it out over a decade so we can rebalance the administrative insurance workforce that, oh, by the way, is going to be displaced by AI, so we better start thinking ahead anyway. Every economic study shows what every other developed nation in the world has already figured out, that when it comes to policies to defend and provide for the general welfare, read the Constitution, of a nation, which includes defense, healthcare, and a dignified retirement, if we're to update our understanding of what general welfare means, then only the government can provide the solution. Markets are designed to extract profit, not provide value. That's why the incentive structure for private health insurance is upside down. These companies can't work to our collective benefit because they're designed to do the opposite. Profit is extracted from limiting care, not extending it. We spend roughly 20% of our GDP on healthcare, about double what other developed nations spend per capita, and yet we have shorter life expectancies, higher infant mortality rates, and we leave tens of millions of people uninsured or underinsured. All studies show that Medicare for All would be a $500 to $600 billion total savings annually. That is not speculation. That is based on multiple peer-reviewed comprehensive economic analyses comparing administrative costs, negotiating power for drug prices, and reduced provider administrative burdens. So Democrats and progressives now have to fight a two-front battle. Front one, reject any inflationary proposal that comes out of the White House because it just won't work. Trump's health savings account will incentivize cost increases from the market. It will make things absolutely worse, not better. We have to be loud and clear about this. And front number two is to fight against the worst instincts from the conservative and bought and paid for problem solvers caucus within the Democrats. These people are actively working against the interests of the Democratic Party and working Americans. As a practical matter, I think they should all be primaried. They at least have to be called out. And in this instance, please, they just have to be ignored. Because this healthcare crisis isn't an accident. It's the predictable outcome of a system that was designed to generate profits rather than health outcomes. And every Band-Aid solution that preserves the role of private insurance just perpetuates the problem. So, we'll follow up when the proposal finally hits the wire and the shit hits the fan. But in the meantime, check out Stephen Semler's Substack and sign up for our free weekly newsletter at unftr.com to stay abreast of topics like these. And you can find me on Blue Sky and YouTube by the same handle, at UNFTR. And on behalf of the UNFTR team, I just wanted to extend a heartfelt happy Thanksgiving to all of the Meidas Mighty.
Love this video? Support independent media and unlock exclusive content, ad-free videos, and custom emojis by becoming a paid member of our YouTube channel today. You can also gift memberships to others. Let's keep growing together.